You're live.
Hi guys, good morning, happy Monday. We are back in action with our TruSculpt Flex. So what I was just separating here are the Flex applicators. So they are color coordinated. There's ones and twos, and then there's also the red and the black wires. So for anyone who's really familiar with how electrical works, there is positive and negative, and it's going to be a very important factor in how we lay out these applicators on the body. I've already started to apply some of these here. So these are going to be focusing on the oblique muscles right off to the sides here. For men and women, this is going to be what really cinches in the lateral abdomen and gives us that shaping alongside the hips. So that's really nice, but the red is on top, black is on the bottom. So we're going to be conducting energy or electricity actually through top and bottom applicator. Same thing on this side, top to bottom. And we're going to apply the abdominal applicators the exact same way. So I'm going to start basically finding where his ribs end, and you can see the borders right through there. So we're focusing our energy all on the muscle. So this is treatment number 2. Treatment number 1 was last week, 4 days ago. Today would be day 4. And so what we're looking for is a little bit of soreness. It doesn't have to be super strong. We're still working the muscles, but the stronger that we work them with a higher setting in each treatment, the more sore the patient would feel. And there's also, and that's going to be our setup for right now, there's also going to be different settings that we set the device on, whether you are new to working out or if your muscles are already quite strong and toned. There's a difference between spacing, which is totally fine here. These are really close together. These are a little bit further apart. What's cool about this is that the spacing actually has nothing to do with how the energy is conducted, because the energy that's going down into the muscle is going to circulate and flow through each handpiece, no matter where it is on the body. So very customizable for someone who has a long torso, short torso, if they have a wider area between the hip bone and their rib cage, we can make it fit just about any patient. So that's something that's really unique about TruSculpt Flex. So our setup is complete, and those applicators are going to just stay in place. I want to really show you how it's going to work. So I'm going to get his treatment started, show you what the contractions look like. Then we'll put the rubber binder to just make sure everything is nicely secured in place and start the treatment from there. So I'm going to turn it on. So it's a 45-minute treatment, and we start off pretty slow. So you should start to feel it about now. So you guys can see some of these contractions start. You can see the twitching of the muscles. And all of these are really well adhered to the skin with this sticky gel coating. It's going to protect the skin and also make sure that the energy is being pushed deep underneath into the muscle itself. So our patient gets about 2 minutes of an introduction into what the contractions feel like, and after that, we're going to bump up the energy. The contractions are going to get stronger, and they'll continue to progressively increase for the rest of the treatment. Of course, as long as the patient's tolerating it and super comfortable. So far it's pretty low. Right now it just feels kind of like, what would you say it's like this on your muscle? Like a little like twitchy, rhythmic? Or is it squeezing?
Yeah.
Okay, so right now it's squeezing. So the device itself, the way that it's toning the muscles, has different rhythms and different methods of contracting. Sometimes, do you want me to grab you a pillow?
Yeah.
Sometimes it's going to be twisting, sometimes it's squeezing, sometimes it's like a drumming, pulsating type of sensation. So it's going to just change the entire time, and all the different ways that it's contracting is going to help the muscle to build, to essentially tear muscle fibers and then rebuild stronger. Are there any questions so far about TruSculpt Flex?
Someone just joined and they're asking if you can explain it one more time.
Sure. So in a nutshell, TruSculpt Flex, that's our cue. We're going to go up a little bit so we can watch to see how they change. There we go. Definitely feeling them. Are you okay?
Mm-hmm.
Okay, I'll give you a second right here. I'm gonna lay you back a tiny little bit too. Is it too strong?
No.
Because I can go down.
can have a look.
Okay. So, it's up there. All right, perfect. So, TruSculpt Flex is Cutera's muscle toning and strengthening device. So, electric current that is passed between these applicators. You can see the positive and negative pads here on the body, red versus black wiring. So, the distribution and placement is really key in how we work each individual patient's muscles. For some patients, it's going to be a twisting motion to kind of get the muscle familiar with the system. And for others, it's going to go right into strengthening and toning. Really just depends on what the patient's muscles are able to tolerate and how strong they are so far. So they're going to continue